So, getting towards the incident, does anybody have any idea what happened?
We have front staff, nursing staff, pharmacy, physicians, our management team, and so everybody has a take on the situation, which is really important because you can hear it from everybody's perspective. I think it makes everybody feel like you're being heard and that what you have to say is important.
So having the huddle there is really nice chance for us to get to communicate with each other, bring up any certain issues that we may have had during the day.
Any new tickets? Doesn't look like.
Initially when they were first announced, yeah, there was a little bit of that feeling of uncertainty just because we didn't know what it all entailed and what it would bring.
It was like, oh goodness, like an interruption into your day, and I'll just figure I'll try to make it if I can. And I think it was just the knowledge of not really knowing what we were going to get out of it. I think it's extremely beneficial, 100%. Being able to hear people, hear your colleagues, understand as a team what we're doing to make sure our clients are safe.
We have some recognitions.
It's really important to recognize when we do good work because it's our clients' best interest that we have at heart, and it just feels good to know that you've done a great job.
What makes it successful is just the commitment that we have from each of our team members, whether if it's for the person who's leading huddle, having that commitment to start it, or all of us working together committed to try and figure out a solution or a new efficiency goal.
Has anyone else experienced this one?
I do think it's been valuable. It's also a good way for everybody to just regroup at the end of the day because times are stressful and we don't always do that. So it's a little bit of kind of like social contact that maybe we haven't stopped and had as a group.
I was not thrilled with the implementation of safety huddles at first because we're all really busy. I think what I needed to know or got to learn through the experience of it is how it makes things work better.
Because that just bogs down the system unnecessarily.
I was nervous about people then just trying to call me.
Being left with difficult experiences that you don't get to talk about is one of the ways that we burn ourselves out in healthcare. We have to make a lot of really deliberate efforts to make sure that the voices of people are actually being heard, and people speak more at safety huddles than they do, for example, at team meetings.
So plan is all of us monitor for a change in process.
So this has given us an opportunity, something comes up that day, we can review it as a team, come to some solutions or some planning, and then if there's bigger issues that require more team input or more discussion, then we bring it to a team meeting. But we've been able to, I think, put out small fires before they become bigger issues.
So before safety huddle, our nurses would stagger in and out. So there was not a lot of really great communication or awareness in terms of what's happening. But this has given them the platform to share their experiences, to share any issues that they encounter in their day-to-day, because they're able to come together as a team.
Really, it's just coming together as a team and being able to share those concerns and learn from each other, and yeah. And it's nice, the recognition piece is really good because it's nice for us to recognize each other and the good things that we're doing. We're looking out for issues of safety for ourselves, but also for our patients and our clients.
So I have been getting some RLs from you guys just in relation to unexpected pressure injuries that you're finding when we're admitting clients. And so what I'm doing is I'm kind of just flipping it back to the appropriate unit for further follow-up.
I love that our team is engaged. They just don't hesitate to ask and jump in, and they feel very safe. Nothing is a silly question. It's one of the sessions I actually look forward to in my day. I feel it's also a sense of bonding with the team.
All right, so I'm going to start. Welcome everyone to the Safety Huddle. Any incidents anyone has to report?
It actually was great at helping us formalize and putting it all together in a way that we can monitor some of the work that we're doing and see an impact and talk about it on a regular basis.
There was a client missing the meds, like a little note.
It's not so specific about this one client. and then we maybe start to see patterns because we're looking for patterns. And I think recognizing all the work that people just do every day, it's just part of their job, I think it makes an impact on people.
And they're very receptive. If this doesn't happen after the fact, when we phone back.
Making it our own, I think, has made it successful. Yeah, making it something that our team is interested in.
Thank you, everyone. Have a good day.